I'm Leonard Weinstock, a gastroenterologist in St. Louis. I'd like to talk with you about irritable bowel syndrome. Many gastroenterologists and internal medicine doctors and family practitioners do not like patients with IBS. That's a harsh statement, but the fact is, it's true. It's frustrating dealing with these problems. It's a syndrome, namely we don't know what causes it, or at least many people don't know, but more is become understood so that we know how to treat many patients now in a different way than has ever been before. Irritable bowel syndrome is a syndrome namely comprised of symptoms, abdominal discomfort, altered bowel habits with different form and frequency, and partial relief with passage of a bowel movement. Many different diseases have these symptoms, and yet if you exclude other conditions such as Crohn's disease, ulcerative colitis, and celiac disease, you can come down to a condition of irritable bowel syndrome. For years, people thought irritable bowel was due to hypersensitivity of the gut and tension and stress and depression magnifying symptoms from the gastrointestinal tract. In the year 2000, things began to change. At that time, I was the advisor to the Irritable Bowel Syndrome Internet Support Group, and an email came in, said, "What's going on, Dr. Weinstock, with antibiotic treatment of irritable bowel syndrome?" So I picked up my American College of Gastroenterology journal, and I reviewed that. And indeed, there was a very nice article by Dr. Pimentel and Dr. Lin at UCLA, and they treated patients with irritable bowel syndrome using lactulose breath testing as a means to determine if they had bacterial overgrowth, and then they used neomycin as an antibiotic to treat the disorder. Many patients got better, certainly more than placebo, and that's an important measure of anything in medicine. The ways that I took that forward was to try antibiotic therapy on patients. And I often preceded that with a breath test, and if it was positive for bacterial overgrowth, I would treat them, and many of the patients got better, but not for very long. Then things changed. In 2005, a new antibiotic came out that was not absorbed from the gastrointestinal tract, and it covered many more bacteria that reside in the colon and small intestine. And yet it did not cause significant damage to the colon bacteria, which are often helpful and beneficial to the body. In any event, we found changes in our patients that we never saw before. We found people who had irritable bowel for 15 years were treated with the special antibiotic and approach to treating bacterial overgrowth, and they did really well. Many times, some of the symptoms that they had that were not directly related to irritable bowel syndrome got better, and those included fatigue and, some of my patients, restless leg syndrome. So we are now coming around to have a new understanding of bacterial overgrowth. More research has been done about the role of methane producing constipation, hydrogen producing gas, bloating, abdominal pain, and diarrhea, and underlying motility disturbances of the small intestine that allow this to occur. Namely, when the small intestine is slow, the bacteria back up from the colon into the small intestine and grow and cause inflammation.